Hi, this is Bhavin, Dr. Dave, and I'm a gastroenterologist, and I just wanted to give you my way of explaining Barrett's esophagus to the patients. Now, Barrett's esophagus is a condition wherein the lining of the mucosa changes into something which could turn into cancer. Specifically, it is goblet cells or intestinal metaplasia. Now, this is a mouthful. It's very difficult to explain it to the patient, especially when you have Barrett's esophagus without any dysplasia, and then you have got Barrett's esophagus with low-grade dysplasia, then you've got Barrett's esophagus with high-grade dysplasia, and then you, on top of it, finally it turns into cancer. And then there are different sizes, and you can always explain the C0M0 classification, which is the standard of care. But this is the way I explain it, is that let's say that you go outside and you look up in the sky and there are no clouds. And I would ask you, is it going to rain? And you say, no, it's not going to rain. So that's normal mucosa, and that's what is a normal mucosa is. There's no cloud and there's no rain. If it's downpouring and it's really heavily pouring, that's what we call as cancer. So we have normal, wherein there's no clouds in the sky and it's raining heavily, and then you would say that this is probably, that's cancer. Then the stages in between. So Barrett's esophagus is a condition wherein you go outside and you find that there are some dark clouds out there, and they look a little bit, there are some clouds, and you would call that as Barrett's esophagus. And let's say you go outside and you find that, say that the dark clouds are really low lying, there's some wind blowing, and it looks like it's probably even more likely to rain, and that's what we call as Barrett's esophagus with low-grade dysplasia. And let's say you go outside, you see the dark clouds, and you see that a couple of drops of rain are falling on you, and that would be Barrett's esophagus with high-grade dysplasia. You know this is just about to rain. You just got this is the time to do now, or you're going to face the consequences of cancer. And this is how I explain Barrett's esophagus with different kinds of dysplasia to my patients.